I'm Claudine Diaguirre from M2A section. So today is I will be doing the hot compress and cold compress application. So first is I will verify my patient. Hi ma'am, my name is Claudine Diaguirre. Your student nurse. Can I please know your name,
Princess Day,
your birthday,
December 7th,
your age?
19.
So for verification, can I please check your ID band on the unaffected area? Okay, so after that, I will now verify the doctor's order for the type of application on the cold compression, the location, the duration, as well as the desired temperature. Okay, assume that I've done that. I will now review the client's chart as well for the medical history and any contradiction that may prohibit the use of the cold compression and as well as the warm therapy. And then after that, I will now assess my client's skin condition on the affected area to be treated. So I will now expose only the affected area. So is it okay if I may slightly touch the affected area po? And please tell me if you feel any pain or sensitivity. Okay, do you feel any pain po, ma'am?
Yes.
Okay, so after that, I will now inspect for the wound, for the size, the color, the odor, as well as the tenderness and drainage. Okay, after that, ma'am, I will now assess my client's understanding about the procedure. Have you had any cold compression and hot compression before? Okay, are you aware for the procedure?
Yes.
Okay, after that, I will now assess my client's vital sign, including the PP, HR, and the RR on the unaffected area. Okay, assume that I've done the vital signs. So the unexpected outcome are to reduce the pain and the swelling as well using the cold compression. And then after that, I will now assemble and prepare all the equipment to conserve time and energy. And then, so today, ma'am, is I will be doing the application using the cold compression on the affected area, and rest assured that everything will be followed under the safety protocol po. So now I will now close the curtains to provide privacy as well as the door if there is any. And then I will now position my client on a comfortable position. Okay, so after that, I will now perform my hand hygiene as well as do my proper gloving to prevent the spread of microorganisms. And then now I will now place a waterproof pad or a towel under my patient's affected area. This is to protect the bed linen. Okay, so after that, I will now place a towel with the excess water and moisture it on using the cold compressor and wrap it to properly maintain the temperature of the cold compression. And then after that, I will now put it on my client's affected area for about 15 to 20 minutes. I will now put it na po. Is it okay lang po yung temperature? Okay, so after that, I will also check for the skin condition at the appropriate as well as the regular intervals as well, which is for 15 to 20 minutes na po. And then after that, I will stop the application immediately if there is any discomfort toward my patient. Then after that po, I will now remove my gloves and perform my hand hygiene po. Assume that 15 minutes and 20 minutes is now done. I will now help my patient on a comfortable position again. Okay, after that, I will now remove, clean, and dry as well and dispose all the equipment. And then, after that, I will now inspect for the body part of the wound condition for any evidence of the effectiveness of the cold therapy and sensitivity to touch. Okay, ma'am. So, do you still feel any pain po? Slight na lang po. Okay po. So, So I will now ask my patient to describe the comfort level or discomfort level as well. So on the scale of 1 to 10, ma'am, 10 being the most painful, can you please describe the pain?
4
Okay, so after that, no expected outcome naman po were noted. And then after that, I will now reposition again the affected area and cover my patient for privacy and warmth. And I will also document document all the report that have been documented and tell it to the physician. And that's it. Hi, my name is Bindi Aguirre from M2A section. So today is I will be doing the hot compression naman po. So first is I will verify my client's identity. So first, ma'am, can I please know your name,
Princess Day,
your birthday,
December 7,
your age po?
19.
For verification, can I please check your ID band on the unaffected area? Okay, so after that, I will now verify as well the order for the type of moist heat application, as well as the location, duration, and the desired temperature. Okay, assume that I do that. I will also now review my client's chart for the medication history, as well as the contradiction that may prohibit the application of the heat compression. And then after that, I will now assess my client's skin on the affected area. So I will now expose po the affected area only po. Okay, so can you please tell me if you feel any pain or sensitivity? Do you feel any pain po ba? Okay, so after that, I will now as well inspect for the wound, for the size, for the color, as well as the odor and the tenderness and drainage. Okay, so after that, I will also assess my client's knowledge about the application of the hot compression, ma'am. So do you know the procedure po of the hot compression? Okay, so feel free to ask me question po during the procedure if you feel any uncertainty po. Okay, so after that, I will now assess my client's vital signs as well, including the blood pressure, RR and HR on the unaffected area. Okay, assume that I am now done checking the vital signs of my patient that may contradict on the application of the hot compression. So I will now identify for the expected outcome. So the expected outcome po here is to reduce as well as the pain and swelling on the affected area po. And then I will now prepare all the equipment, the necessary equipment to conserve time and energy. And then after that, so today, ma'am, is I will be doing the application on the hot compression po so that we can help to heal your affected area po. Okay, so after that, I will now, so the sensation po, I will now describe the sensation of my patient wound to and precaution as well to prevent any burning or any contradiction as well. And then after that, I will now provide the privacy for my patient by closing the curtains and the door as well, if there is any. Then I will now position my patient on a comfortable position and adjust the bed as well if necessary. And then I will now perform my hand hygiene as well as gloves to prevent the spread of microorganisms. Okay, so after that, I will now place a towel underneath my patient's affected area to protect the bed linen as well. And make sure not to touch the affected area while doing that. So now, I will now apply a heat compression to the affected area using this heat compressor for 15 to 20 minutes as well. So now, I will now put na po the hot compression. Is it okay na po yung temperature? Okay, so and then after that, I will stop the application immediately if my client feel any discomfort while doing the procedure. And then after that, I will now inspect for the body part of the wound condition and the evidence as well of the effectiveness of the warm compression. Okay, so after that, I will now ask my client to describe the level of the comfort po. So, ma'am, do you feel on the scale of 1 to 10 po, the 10 being the most painful, how well is the procedure po, yung pain po na nafe-feel nyo?
5.
Okay, so after that, I will now obtain again the vital signs and compare it with the baseline on the before doing the procedure as well. Okay, after doing the vital signs now po, I will now remove my gloves again and perform a hand hygiene and disposes on the right receptacle or the yellow trash bag. And then, after that, I will now slowly remove as well the towel of the affected area. And then, dispose it again and clean everything properly. And as well as cover my patient again for privacy and comfort. And then after that, I will now document as well and report it to the physician all the things that we did for today and the procedure.